October is Breast Cancer Awareness Month, a time dedicated to education, early detection, and supporting those impacted by the disease. Joining us again today is Deanna, nurse practitioner and associate medical director for Omni Family Health, to talk about the importance of screenings, risk factors, and the progress being made in prevention and treatment. Hi, Deanna.
Hi, thank you for having me again.
Welcome back. Okay, so let's talk about why observing this month and doing the highlighting and specifically the education is so important in October.
I think it's just a great time to remind people how common breast cancer is and how early detection can help save lives. You know, when we do these awareness months, we talk more about it, which leads to more screening, and ultimately that could save somebody's life.
Yeah, I think a lot of people, you know, mostly find out by accident. It is a by chance thing, and that's why the screenings are so important. So let's talk about when we should be screening with mammograms specifically.
That's a great question. So mammograms begin at age 40 for most women. However, if you have higher risk factors, you might be a good candidate to start screening even earlier. So talking to your doctor about what's best for you is a great plan.
And I think because that age limit is there, it's so important to highlight why we should be doing self-exams at home, because breast cancer does happen before 40 in women.
It does. It certainly can, and you can have abnormal lumps and all sorts of things. So with the self-screenings, you know, we tell women, you know your body better than anyone else, right? So look at yourself in the mirror or feel every once in a while. If you feel something that doesn't feel normal for you, doesn't look normal for you, it's time to tell your doctor.
Yeah, and it's always something you should never ignore, because even if it's nothing, even if you thought you felt something, it's always better to be 100% sure.
It is, and I would much rather send somebody for an early ultrasound or mammogram than miss something, right? So let's just check it and make sure we're not missing something.
So what are the current recommendations for breast cancer screenings? Have those changed in recent years?
Yeah, the general guideline is yearly mammograms starting at age 40, but some organizations are starting to say every other year. So the best plan is just to talk to your doctor about what's best for you.
So, you know, a lot of women put off mammograms, you know, whether it's fear or busy mom schedules, but what message would you have for them, especially since we're highlighting breast cancer this month?
I mean, number one, I totally get it, right? We're busy, we've got a lot going on, we're juggling our entire lives, so I get it. I'm turning 40 this year. I've already made my mammogram appointment for the day after my birthday, so yeah, it is possible. I think one thing to remind people is it only takes a few minutes. You know, you take these couple minutes out of your day for you, and that gives you an entire year of peace of mind.
I think sometimes it takes longer to actually book the appointment than it does to do the appointment.
Exactly. You're like, oh, it's done already. Another thing too is if they find something abnormal, early detection is so important because find it before it turns into a big problem. You know, when you find something early, the treatments are more effective, they're easier, so we don't want you to wait.
Yeah, the outcomes are significantly different when you are able to detect it earlier.
Absolutely.
So let's talk about, you know, risk factors that patients might need to be aware of, so maybe they do fall into that category of needing to get one prior to 40.
Sure, so family history does matter. You know, if you have a mother or a first-degree family member like your sister or grandmother that's had breast cancer, we take into consideration that, you know, when we talk about when should we start testing. But a lot of breast cancers do happen in women that don't have any family history of it. So that's why awareness is so important for everybody, and your lifestyle really does matter.
Yeah,
you know, are you exercising? Your diet, smoking will significantly increase your risk. So there are things that we can modify and change to lower our risk for breast cancer.
So beyond screenings, there's been a lot of advances in treatment. So has there been things recently that make you hopeful for treating breast cancer in the future?
Oh yes, there have been some really cool things that the radiology centers here in town too are doing. Early breast cancer and enhanced breast cancer detection. So their machines have gotten techie. I mean, they can detect the smallest little things much better than they did in the past. So, you know, I think that prevention and early detection together, it makes me very hopeful for the future.
So if somebody is listening right now going, I need to schedule that mammogram, which if you're over 40, you absolutely do, friends at home, how do they get a hold of you?
It's very easy to book an appointment with us at Omni Family Health. Call us, give us a call, go online, pop into one of our clinics. This is a quick and easy visit for us. We would love to see you for this. We'd love to see your faces. So just come on into the clinic and we'll help you get scheduled.
Amazing. Thank you so much, Deanna. It was great having you back.
Thank you.
All right, we're going to keep chatting more Studio 17 right after this.